Great. Hello, everyone. I'm Hannah Heckner-Swain. I'm the VP of Strategic Partnerships at Silverchair, the platform provider, and you've made it to the last session of the day. On that note, please do not run out when we are finished at 6. Malavika will come up and give you some information about the reception this evening, as well as some instructions on how to get there. The reception begins at 6:30, so you'll have some time to walk. So yes, welcome. We are going to be talking about assessing real-world return on investment, tracing the true value of open access publishing. There have been lots of great conversations today on sustainability, equity, future of open access thus far. There's been a lot of focus on work to be done. So we're really hoping today that we can also reflect a little bit on all of the great things that we've seen from OA thus far. There's been a lot of impact, and a lot of these investments that have been made have been incredibly valuable. Also, talking about impact a lot, I want to say thanks to Hasib. Hopefully he's still listening. He really teed us up really, really well in some of his comments in the last session. Perhaps this colors me as a certain kind of person, but I feel like when you can point to, what's in it for me, what's in it for the organization, that movements will have a lot of staying power, that initiatives will get continued, that projects will be getting continued. So sort of with that spirit, we're going to be digging into initiatives, projects, and products that really seek to calculate and communicate the return on investment in OA. Said another way, what's in it for the person or group footing the bill? This conversation will be grounded by presentations by my esteemed panelists here. We'll kick things off with Rhodri Jackson, the Director of OA Publishing and Strategy at Oxford University Press. We'll then hear from Manisha Bolina, the Senior Partnerships Manager of BMJ Impact Analytics with the BMJ Group. We'll then hear from Tasha Mellins-Cohen, the Executive Director at Counter and also founder of Mellins-Cohen Consulting. And last but not least, we'll hear from Blessing Mawire, Program Lead of Countries at Research for Life, and the Partnerships Coordinator at the Council on Library and Information Resources. So let's start with some numbers here, just to sort of ground our conversation. So according to Delta Think's Open Access Market Sizing Sneak Peek, published a few months ago in July, OA content accounted for 48% of all of the scholarly articles published in 2023. That same year, the overall market sizing of the scholarly publishing market was around $10.8 billion. In 2022, the Delta Think OA market sizing, shout out to Delta Think. I'm using a lot of your data today. Thank you. That OA market sizing in 22 put OA at a non-proportionate amount of revenue in the overall scholarly publishing ecosystem. It amounted to 15% of the revenue, while the volume of content accounted for more of that revenue. So that got us to around 1.6 billion tied to OA in 2022. It was estimated in 22 that this OA revenue would grow to about 2 billion in 2024. As many of us in this room today know, certain projections in 22 about 24 didn't happen. So let's be a little bit conservative in some numbers that we're using today. And let's say there's about $1.75 billion of OA revenue in the market. It's a nice round number to work with. So OA revenue is going to be money that's directly tied to APCs paid, deals meted out with institutions, etc. So you can also see this revenue as a $1.75 billion investment in global open access, which of course, as we've heard today, in this world of, in this industry, there's lots of labors of love. So that 1.75 billion doesn't even come close to calculating the people hours that go towards things like services, establishing processes, initiatives, and infrastructure. So how do we truly calculate the return on this very sizable investment? There's a lot of people and a lot of passion in this conversation. Of course, there's the mission element. Are these dollars aiding in the accessibility of content? Can I read this? Are folks not only able to read this content for free, but is it discoverable? Is it digestible by the people who will most benefit from the content? Is it furthering the mission of the organizations or individuals who are paying the APCs, who are paying the transformative or subscribe to open agreements? And also those paying for the very non-insignificant costs tied to the technology and infrastructure that really make OA happen. So that's the mission bit here. Also, there's of course money in this. There's a lot of revenue tied that can be attained through OA investments. This is going to be a little bit easier to calculate. You request money from APCs, from transformative agreements, and you put money into the infrastructure to support that OA publishing. As for the people in this conversation, there are many overlapping stakeholders and beneficiaries here, certainly not limited to this list. So a lot of things to think about here. So here's my references, mostly Delta-Think. So we're going to start out with a poll. If we can launch the Mentimeter, that would be great. Just to sort of see from this room here, what's the most vital indicator to your organization that investments in open access, so APC payment, transformative deal amount, paying for supporting infrastructure, et cetera, were worth it? Is it something like increased article usage? Is it expanded global footprint of article usage? Is it increased article citation, mentions in policy, mentions in patents, news and social media, or indicators of societal impact? Incredibly important things that can be a little bit hard to determine. So we'll give y'all a few seconds here. Getting lots of thumbs up. That's great to see. And then maybe we can we pull it up as the answers come in, the results? Oh, here we go. Okay. Maybe as answers come in, we can just transition and Rhodri can come to the stage. But thank you, everyone. Okay. It'll be great to hear from folks how they're calculating that societal impact, which will be something we'll want to dig into later. Usage, of course, that's a straightforward thing. Okay, great. Okay, impacts, societal impacts winning out.
No one's interested in patents at all.
Yeah. Industry is a huge stakeholder in this conversation, and it's one that I would love to hear more about and to have more of a subject in future OA discussions because, I mean, industry and corporations have a lot of money that can go towards OA. Okay, great. Want to kick things off?
Yeah, if we can have the slides. Yeah, so thanks everyone. So I'm going to talk a little bit about a couple of things in relation to OUP and return on investment in open access, or the benefits of open access, I think, may be a better way of putting it. So I'm going to talk about census impact and why we're involved with that, and then I'm going to talk about the return on investment you see through transformative agreements. And then I think some of my colleagues are going to talk about, so I'm focusing a bit more, we saw usage there, so more on the kind of more prosaic publishing elements of return on investment. And I think some of my colleagues are going to get into the more, impact, wider societal impact points, which also came up quite strongly in that Mentimeter. So I think for a long time, publishers have been able to demonstrate the value of purchasing subscriptions to institutions through, in a consistent way, through counter and similar ways of measuring usage. And I think we've also spent a long time telling people about the value of publishing open access with a publisher, of publishing the version of record open access, of having the final published version available, the best version of the article, et cetera, with all the benefits that entails. But I don't think we've done a good enough job as an industry of demonstrating to funders, institutions, and whoever else is paying for APCs about how paying for an article to be open access through whatever method, whether it's through an APC or a transformative agreement, benefits that research, and how you can compare that across publishers, across journals. Why publishing in journal A might be more beneficial in terms of return on investment than journal B, for example. And with that in mind, one of the things that we've worked on with Silverchair in recent years is census impact. which is available. You can go and find it online, just search for census impact. But it's basically a dashboarding thing that funders can use to look at the articles that have been published with the benefit of their funding, and look at things like the alt metrics related to those articles, citations, usage, etc., and look at that across publishers and across journals. It's still, developing. It's consolidated across multiple publishers, but there's still more work to do, and there may be more things to look at in the future beyond those 3 points that I've mentioned there: the downloads, alt metrics, and citations. I think it's an important thing to do, as I said, because I think as publishers we can definitely do a better job of explaining to people, just what they're paying for by publishing with us or with this journal. So do take a look at census impact. Thinking about transformative agreements as well. So I know transformative agreements are a slightly controversial topic in some areas. So they've definitely meant more content has moved to open access, but not everyone agrees with the speed at which they are transforming to open access. But personally, I think that transformative agreements have made a big difference in recent years in making that move to OA that we've talked about quite a lot through this conference, and the progress towards OA has been more rapid, I think, in recent years, partly because of transformative agreements. So OUP, we have around 65 transformative agreements in place across the world. This map, the yellow, shows where we have at least one transformative agreement in place. And the pink shows countries where authors don't need to pay APCs because they're automatically waived for authors from those countries. And so essentially this is just trying to show where countries in the world that through these various initiatives, authors don't need to individually pay APCs. But if you look at the growth of transformative agreements at OUP, so since 2020, we've had a dramatic growth in the number of articles published at OA through these agreements. So from around 1,500 in 2020 to more like 6,500 in 2023, and then there'll be more this year. And the red line there, which is a bit blurry, sorry about that, shows the percentage of our total hybrid open access articles which have come through transformative agreements. So back in 2020, around 25% of our hybrid OA articles came through these agreements. Now it's more like 50 to 53%. So it's a big increase. And just for context, so OUP publishes around 66,000 articles across all our publishing, and it publishes around 45,000 articles across our hybrid publishing. So this is an increasing and quite significant share of our content that's been made OA through those agreements, which is helpful. And one thing I think is just thinking about the impact of this and what an institution or a consortium who's buying a transformative agreement from a publisher is getting. I think one of the things that sometimes isn't recognized enough is the impact it has in subject diversity. So these two graphs, apologies, they're slightly different sizes. I was struggling with matching it all up on PowerPoint. But basically, on the left-hand side, you can see open access articles published by OUP from UK authors in 2020 in our hybrid journals. And on the right-hand side, you can see the same graph for 2023. And essentially, before in 2020, which was before OUP had a transformative agreement in place with JISC, only around 14% of our open access content was coming from either humanities and social science journals or law journals, so non-STEM journals. And in 2023, that proportion had completely changed. So we had 33% of our articles that were OA in humanities and social science journals and 7% through law journals, so 40% in total. And I think if you're thinking about the impact of that transformative agreement, I think that's a really important impact, which is often overlooked. The authors who wouldn't have had access to APC funds and wouldn't have been able to publish Gold Open Access in the past are now able to do so. And that's just for JISC in the UK, but I can show you a comparable chart for any other agreement we have in place. Just briefly, as well, I sort of focused on the kind of publishing metrics. So this is a rather busy chart, but the main point is the line at the bottom. So this is OA content versus non-OA content published by OUP in 2023, and the impact of OA on the alt metric score. So, on metrics comprising a bunch of different ways of the work being referenced or quoted, or news articles being written about it. And it won't surprise anyone really in the room to show that the OA articles here were used, or sorry, had much higher op metrics. With the slightly unusual exception of life sciences, I imagine there's some sort of outlier behind that. But all other subject areas seeing up to a 200% increase in op metric for open access articles. And a similar notion on citation count, so looking at articles from longer ago. In this case, the open access articles in the hybrid journals were cited up to 73% more, 72.5% more in life science journals, and it also increased across the board. So I think so just in transactional terms, I think we see that the impact of OA, as we know, is greater usage, greater op metrics, greater citation. I think through transformative agreements, we see the impact of just more OA, and a lot more OA. So OUP publishes, as I said, around 67,000 articles a year. Now, for the first time this year, more than half of our research articles are open access, so around 55% of them. That's a big change since 2020, and that's largely through the transformative agreements we have in place. But I do think that we and all publishers should be doing a better job of demonstrating that value, and we're trying to use tools like Census Impact to do that. So I'll hand over to Manisha.
Your second pie chart made me feel really good, actually, even though I work for a medical publisher. So good afternoon, I'm Manisha, and today I want to talk to you a little bit about different type of impact, right? So before I joined BMJ, I used to work at a company called Digital Science. So I've been thinking about impact in lots of different ways, impact through sort of academic perspective, alternative metrics perspective. And I joined BMJ about 18 months ago to really understand impact through a different lens, thinking of us, how it impacts all of us in the way that we live our lives, okay? And I'm really passionate about this subject area. And you'll see that as we go along in this presentation, because it's really quite close to my heart. So as you might know, we have rebranded now. We are BMJ Group, okay? So we're not just the BMJ, but we've rebranded, so using these new exciting new slides for the first time. But I think what's really great about working for this kind of healthcare organization is it's all about trying to move the dial forward in trying to build a healthier world. And I think, the journals business that we have is really at the heart of all of that. And when I think about, over the years, how many journals we've got, and looking at the number of those that are open access, I think we can agree, it's really great to see that. And actually, we're going to be launching another 4 new open access journals next year as well. But even the other things that we do, such as clinical decision support, that is all about building tools that enable impact at the point that people access healthcare. So that's patients, that's you and me. We go to the doctor, you've got gout, how's someone going to treat you? What research impacts that product, which then, the doctor will treat you and say, no, you no longer have gout now. And what is all that about? So this is what we're trying to do. So for us, impact is more holistic. It's not just about, churn out a journal, get a citation, woo, it's in the BMJ, that's great. But actually, it's more about putting the research ecosystem together and understanding, how we can make better decisions with better evidence and build better systems and infrastructure, because part of what we do is also, supporting the British Medical Association and the NHS. So it's putting that back into, our own healthcare systems and supporting those around the world as well. So I just wanted to look at a few things. I'll actually just get rid of that slide, I realise. And I just wanted to think about, over the last 10 years, how much open access, funded open access content it has been out there. And where I used to work before. So I took these data from Dimensions. And as you can see, the exponential growth, especially during COVID that we had. And I think we can agree that it was a collective effort, especially during COVID, with funders, researchers, libraries, everybody working at home, trying to, support people, whether they are going to the hospital or they're dealing with mental health crisis or they're dealing with political situation, or how are they going to do and pay their mortgage, quite frankly. So thinking about research in that ecosystem and all the funders that funded that research that went on to be open access. And we know that, because of the way Horizon Europe, even the NIH, they talk about publicly funded research needs to be publicly available. So these agenda is bringing and driving the open access movement forward, as we can see. But I wanted to talk about, we're making all that research. What does it mean, and how can we trace, what's important to you and me? So I was speaking to Dr. Claire Arden, and she is also the editor-in-chief of the Journal of Orthopaedic Sports Physical Therapy. She's also an author at the British Journal of Sports Medicine. She's also an assistant professor, but she also does physiotherapy, in her day-to-day job as well. And it was really nice to talk to her because she works, on the ground with patients. She's doing research. She's also, writing research and publishing it. So she has like a proper 360 view. She's also a library user as well. So I was thinking about, what does it mean with impact for her? And she had a really great way of looking at it. And this is an extract from something she wrote in BJSM. And then she says, although a body of literature exists that evaluates the impact of health research, research impact is rarely discussed within the broader fields of sports medicine and sports and exercise medicine. I would argue in general as well, including sports physiotherapy, physical therapy sports and exercise science, sports nutrition, and so on. For the purposes of the editorial, we will introduce and consider the impact of health research in sports and exercise medicine in public policy, economy, and society. I mean, now she's talking about sports and exercise, but I would argue that actually we could look at so much of this within these three or four different elements. I'm not going to talk about academic impact because we all know about the echo chamber of the impact factor. I actually want to talk more about economic, policy, and societal impact, and why this is really important to us, and what happened with research when it got out there in the world. So if we look at policy impact, now I'm going to take two examples. I'm going to take two examples, two of which are open access and two of which are non-open access. This is a non-open access article, but it was funded by the Canadian Institute of Health Research. And what this policy example says is that research in Canada report an elevated risk of injury among pee-wee hockey players in leagues that permitted body checking at the age between 11 and 12 years old, compared with leagues that introduced body checking from 13 to 14 years old. These data contributed to Hockey Canada's policy change to delay body checking until 13 to 14 years old, ultimately, reducing the risk of injury. This is really, really important. And policy changes like this enable us to really improve the way that, sports are done, concussion, injuries, everything, so that we can, have less problems, I suppose, and impact policy change. This is an open access article, and this here we're talking about an economic impact, right? So what we're saying here is in the UK, during 2013, multifaceted physiotherapy for lower back pain improved the quality of life to yield an estimated return on investment in related research to £130 million after accounting for the cost of delivering the intervention. Now, if we think about, we're talking about APCs, we're talking about this and we're talking about that. Look at how much saving we did for the economy just for doing a few exercises, and the quality of life, not just for economic but societal impact that it had. Here's another example of an open access article in societal impact. Oh, that previous one, sorry, I forgot to mention that previous one. That one was gold open access, and it had about 10 different funders: Medical Research Council, NHS Trust, Wellcome Trust, Versus Arthritis, Academy of Medical Science, and a few more which I haven't written down, but we can find it later if you look at dimensions. If we go to societal impact here, for example, Good Life with Osteoarthritis in Denmark is a population-based program that implemented clinical guidelines to treat hip and knee osteoarthritis through patient education and physiotherapist supervised exercises. 12 months after starting the program, patients reported doing more physical activity and taking fewer pain medications than before entering the program. Fewer patients took sick leave during this first year of the program compared to the year prior to participating in the program, improving societal impacts. That's getting people back to work, right? Nobody wants to be on their sick benefits, so we're not draining the economy, we're not draining on the sick leave from your employer, and actually you're all having a better life. You can get back to work and get back to what makes you happy. So the power of these open access articles, is fundamental, and actually those tangible things that none of us can really see or feel or hear, they're so important to these to these people and what affects them when they go to the doctor and they access healthcare. And I said to you why I'm really, really, really passionate about this and why it's so important, because this is my little boy. All right, this is my little boy. He's got autism. He's developmentally delayed. He's got a learning program. He looks cute, but oh my God, he's a right cheeky little thing. All right. But what I want to tell you is that I have really struggled with him in trying to get the right support before he goes to school. And at that time I was working at Digital Science. I was like, I have access to this stuff. I have access to research. And what I really want to do is find out, what is going on in the other parts of the world, because what I'm getting from the UK is not really supporting me. So there I was looking at who funded research and, looking at all the literature. And then I found this particular intervention that they do in the US. And I started doing it at home. And everyone told me that I was crackers and I was silly and everything. And then during COVID, as we were, a couple of years ago, when I started thinking about how am I going to get this now paid for because it's working really well, what can I do to support me? And I remember what the doctor said. She goes, we can only really do what is in the UK NICE guidelines, right? The National Institute of Clinical Excellence, those guidelines. So I went into the guidelines and I had a look. And what I realised is during COVID, there'd been a change in the clinical guidelines to support this intervention, even though nobody wanted to pay for it at a local level. So I took my local authority to court. And I said, listen, here's all the evidence that I've collected. And in your own healthcare system, you say that this is a particular intervention that can help with challenging behaviour, learning skills, and supporting him. And I won, all right? And that's really great because now he has an amazing access. He goes to sleep now and he leaves me alone, because he's been working all day at school. So what I'm saying to you is everybody in this room has a story like this, and open access movement has really driven, and research in general has enabled us to have, fulfill those betterment in life. And just to look at open access, because of all of this and the things that we talked about, BMJ decided to create a tool that would address this particular challenge. Yes, we all had the echo chamber of the impact factor, but actually what can we do to understand impact at the point that people access healthcare through policy citations, global clinical guidelines, not just through large ones such as CDC or NICE or World Health Organizations, but those society guidelines that are like professional body guidelines. How can we see that impact? So here we can see, I did an analysis here to look at over the last 10 years, how many articles went on to be cited in global healthcare policy, global clinical guidelines, and point of care tools used by doctors on the ground. And as you can see, we can see who funds that research, but the amount of global support that a lot of this research is being pumped out, as we know, in the Western countries. But look how much the developing countries, I really hate using these words like global south, but countries where they need support, maybe don't have their healthcare infrastructures, they're citing that research in those policy sources, in those clinical guidelines to support and move the dial forward in supporting their communities and their doctors and rolling out infrastructure in the way that we live our lives. And this is really important for us to see. And who funds all of this? Well, it's the National Institute of Health, it's the European Commission, the National Science Foundation, Wellcome Trust, Medical Research Council, so on and so forth, Government of Canada there. And we can use this analysis to really support, what we're doing in terms of understanding that impact. We can see, obviously, during COVID that, yes, we had lots of publications increasing, but the numbers that went on to get cited in policy, you can see that massive jump there during 2021 and 20 and 2021. And then it kind of tends to peak off a bit. But it was really nice to see then, who were those publishers that were exponential in that open access movement. I'm glad to see BMJ there because we're a very small, medium-sized publisher. And when you think about, the likes of Elsevier and Wiley and Informa Group who really have got a larger portfolio of research, being number 10 in that list is quite powerful. But anyway, I thought I would leave that with you because a lot of what we talk about is money, money, money. But I wanted to show you that all this money that we're spending and creating this wonderful open access and research movements, it really is impacting and helping all of us. And thank you for supporting it. I'm going to let my colleague Tasha take over now.
Great job.
Well done.
Right. How do I follow that? Talking about something as frankly boring as usage metrics. Sorry in advance. Before I start, I would very much like to ask you 2 questions. First question, please put your hand up if before this conference started you had heard of Counter Metrics or possibly our old name Project Counter. Okay, this is good. Please put your hand up again if you thought we were only for subscription usage metrics. Okay, my job is done. I can just go sit down. Excellent. So Countermetrics is the community standard for usage. We have been around for 20 years. We are collaboratively developed by libraries, by publishers, by technology providers, aggregators, you name it. Everybody is in the room. We think that normalized metrics are really important, and I'm going to tell you why. A librarian very kindly a couple of years ago said to me, when I see counter metrics, I know I've got a nice, healthy, organic apple in my hand. When I see usage metrics from like Google Analytics or something, I don't even have an orange. I have a beach ball full of rubbish. Web analytics, we heard earlier today, sometimes they just disappear. Countermetrics stick around. They are comparable across platforms and over time. And we started reporting on open access usage. Let me rephrase that. We don't report on anything. Counter-compliant publishers started reporting on OA usage in 2014. In 2019, with Release 5 of the Code of Practice, we absolutely enhanced our OA capabilities. But Release 5.1, which comes into force in January, is optimized for open access. And if anyone is sitting in this room thinking that all the OA publishers are already doing this, you're absolutely no. Some of the biggest OA platforms in the world haven't even started looking at Counter. They are still relying on Google Analytics. So why measure OA usage with Counter? We've heard, you guys voted in that last Menti. 33 people said that increased usage and increased geographic distribution of usage was a really important, vital metric. Well, this is great. We all think that OA gets more usage than closed content. Prove it. If you want to show me, if you want to show the world that open access drives increased usage globally, measure yourselves the same way that traditional publishers measure themselves. Compare like with like. We can calculate return on investment. So some of the librarians among you will have heard the dreaded term cost per download. This takes the annual subscription price paid by an institution and divides it by the normalized countermetric unique item requests. Really straightforward. Libraries have been doing this for decades. Libraries now want to have a comparable option for the stuff that they have paid to make open access. And you can do that with the same counter metric. You can look at what you've paid under an APC or as a proportion of your transformative deal, and you divide it by the unique item requests, and you know how much that has cost you in terms of cost per download. Now, at this point, I'm going to put my usual caveat up. Metrics, handle with care. Any given metric is often going to turn itself into a target. This is a bad idea. I'm absolutely 100% on board with societal, political, economic impact being far more important than any single number, whether it's come out of counter or anything else. But I would say we're human. We like numbers. They're nice and easy. So let's put usage where it belongs alongside citations that are very direct measures of impact. They have their problems. All measures have their problems. One of the problems with citations that they take a really long time to turn up. We have alt metrics. We've heard from digital science, sort of. I like alt metrics. I think they're really interesting, but they're not necessarily particularly direct measures of impact. They're sort of talking about what people are saying online. Usage, it sort of sits somewhere in the middle. It accrues from the day of publication. It shows some level of interest in the source publication. It's not perfect, but nothing is. So, institutional counter reports, the sort of traditional, in inverted commas, counter reports, show only usage affiliated with that institution. So if you are at Harvard University and you are looking at a Harvard University counter report, you are only seeing your researchers, your students, your staff. Counter's global reports aggregate anonymously, just to be very clear, this is all very privacy protective, all of that attributed usage. So whether it's from Harvard or MIT or the University of Oxford or the University of Johannesburg or wherever it might be, and it adds in the stuff that we can't track, the stuff that is not from university-based people. And the reason that's important is that back in 2020, when I was at the Microbiology Society and we made all of our content free for the duration of the COVID pandemic, we did a quick before and after. And we realized that even before we dropped the paywall, 80% of the usage that we were seeing was coming from outside of universities. Now, a lot of that was stuff that people were coming to an abstract and they could read the abstract but would get turned away from the full text. But that's valuable information that we as publishers should have been looking at and weren't. So yes, these global reports are fantastic for libraries and for funders who want to know about the return on their investment in open access content. It's also incredibly valuable information for publishers from an editorial perspective, for marketing, for sales, for technology. If you're getting a load of usage and you know that it's coming through on what Counter calls TDM, you may well be being scraped by AI, but you can start tracking where that's coming from. So, using Counter for open access. Yes, you've got your institutional reports. That is going to show internal usage and trends over time. It's lovely. It's what we've been doing for 20 years. Counter 5.1 puts our global reports front and center. Now, we have not made them mandatory because, frankly, the idea of another mandatory report made me want to go and hide in the corner, but we are strongly recommending them. And what we are saying to libraries and to funders is that if you want to measure open access, you can put a requirement for this in your deals with publishers. Don't get me wrong, a lot of publishers are already working on implementing global reports because they want that information. But the power to require them is in the hands of the libraries and the funders. Those will allow you to calculate your ROI, as I mentioned, cost per download. It will also help with some of those measures of impact. Again, the economic, the social, the political, much more important than the numbers. Item level reporting is the key here. Traditional counter reports look at titles. So that's the journal, the book, the database. Open access requires that we look at the level of the individual item. Article for journal, chapter for book, database item for database. That will help us look at individual researchers, at individual funders, at individual institutions. And I have tried to be very quick, which means I can now hand over to the much more interesting Blessing.
Thank you so much. All right, I'm going to switch it up a little bit, and I'm going to talk about what we're seeing on the ground. So with the end users, and that we're working on within the countries in the global south. So I'm going to first introduce, I assume a lot of people in the room know about Research for Life because a lot of you are contributing to Research for Life, but there are also those who do not know anything about Research for Life. So Research for Life is an initiative that was started more than 20 years ago, and it was really created to reduce the knowledge gap between the high-income countries and the low-income countries. And this really is what we call a PPP, public-private partnership of 5 UN agencies. So from the Food and Agriculture Organization, the World Health Organization, the Environment Program, World Intellectual Property Organization, and the International Labour Organization, which came together with a number of universities, STM, and over 200 publishers, which is really, really great. And our goal in Research for Life is to reduce that knowledge gap that I talked about earlier, but also in addition to this, we want to make sure that we have increasing participation of researchers from the Global South. So this is something that is in our current strategy up to 2030 to make sure that we have the voice of the researchers from the Global South. So since 2002, Research for Life has provided researchers from more than 11,800, almost 12,000 institutions now in more than 125 countries globally. We do have an eligibility criteria looking at a country's GDP and other indicators as well. And we are making accessible to more than 230 leading journals, including books and other resources, databases, and mostly in the fields of health, agriculture, environment, applied sciences, social justice, but also overlapping into other areas as well. So here, this is a map that shows where Research for Life is working. So you find that those we've got 2 categories of those who are eligible for Research for Life, what we call Group A countries, indicated in the blue. Those are the countries that have 100% access to Research for Life at no fee or any subsidized fee. And then we have what we call Group B countries. These are countries that pay a very minimal fee to access. This is just to maintain the platform. So it's not for profit or anything like that. And this is based again on the different indicators, mostly looking at the GDP of a country. And this is outlined if you'd like more information on the website as well. Then we have those countries that are not eligible and the different regions that are not applicable. So although I'm based in South Africa, I know this is a question I get a lot, but unfortunately, because the GDP is a bit higher, it's not eligible. And this is something we always unpack because of the different diversity of institutions as well. But it's really good to see that most of the Global South countries are eligible for Research for Life. So with the Research for Life strategy, I just thought I would summarize to say that when Research for Life initially started, the focus was on access, was on donation, was on making sure that there's equality, if I can put it like that. And now the new focus is to make sure that we've transitioned into global participation, where we really want to elevate the voices, the presence, and practical participation, not just a tick box of researchers and users from lower income countries or the Global South, and ensure that we provide local empowerment. So I'm going to break these 3 areas down. And within Research for Life, we're really focused on providing the full research cycle. So we're not really about just come and access the resources, but we're looking at research open, what we call research open, considering waive or discount programs through the publisher partnerships, the publishing, where we're looking at how we empower the local publishers that we are working with in the countries, and open science practices. Then we have Research for Life Discover, where, of course, we are focused on the actual content and looking at how we also offer the content in multiple languages and close the different gaps within the Sustainable Development Goals. And within Research for Life Exchange, we're looking now at how we work with editorial boards, editors and their boards, so as society events, memberships and committees. And then lastly, Research for Life Learn, where we are really bridging the knowledge gap and doing a lot of capacity buildings and working closely with the different types of users, such as librarians, researchers, policymakers, and so forth. Within Research for Life, we really do advocate for open access. And here I've just picked a few examples of some of the areas that we're working on. So we advocate for publishers who are committed to making select resources available through Research for Life. So I've given the example of DOAJ and DOAB, and these are some of our partners that we work closely with. We also have open waiver and discount practices through some of our publisher partners, and we utilize data from comprehensive reports. So here I picked an example of a report that has been recently published by the World Intellectual Property Organization that really emphasizes the impacts, and in this case, we're looking at the health impacts of equitable access initiatives and really zooming into Research for Life. So at the end of the day, what the publisher partners are really providing to the countries, and it's really, for us, it's really a great measure to see the return on investment. We also highlight important statistics to illustrate the program's impacts and effectiveness. And in addition to that, we also highlight case studies or impact stories. So we do have a number of reports that you can also tend to see some of the impacts that are happening in the countries. And we lower the barrier to access through IP access setup. So we're trying as much as possible to eliminate the logins and so forth, because there are many challenges at institutional level. And we have active participation of researchers from the Global South in research communications. So we do realize that we need to strengthen the local capacity. And for us to do this, we established an initiative that we call Country Connectors. So this is a program that I'm leading and working with country nodes at national level, and then working to make sure that we really have these local interventions to heighten awareness of Research for Life, but also of the full research cycle, strengthen the capacity of information use and management, and build the communities of evidence users within the national and regional levels. So our goal is to make sure that we create those tailored approaches to the networking, promotion, research cycle, information skills building throughout the countries and the regions, and work much more closer with the real users. There are two reports here that highlight some of the impact stories and some of the work that we've been doing within those countries and the regions. So at local level, what we do is we make sure that we start at the top, where we understand, for example, the SDGs. We then look at the regional level, what is the regional priorities around research. And then we make sure that within the country, we look at the different policies, whether there are gaps or existing policies, and how we can work with the institutions to strengthen these areas, and who are the other stakeholders that we can partner with locally. Within the research industry, again, we look at potential partners even beyond the research stage, where we're really looking now for the advanced researchers at the technology transfer. So working with one of our partners, WIPO, we're looking at what can we do to make sure that we turn research into industry. So this is quite key for us. And we talk about innovations, because when we talk to the government ministries, for example, they're really interested in, okay, we work with you and we improve this first part of the research cycle. But what about when we talk about the research economies? What is the impact? So for us, that is something that is quite key. So we also are looking at ensuring that we improve the skills of local publishers in the Global South. So working with editorial teams, and we're making sure that we build their capacity and improve the publishing operations. And we focus on also increasing awareness of open access systems to empower local researchers and institutions, and make sure that we extract maximum value from existing systems to ensure that there's sustainable research practices as well in the country. And for us, partnership is quite key, and we've got varied types of partners that I'll talk about a little bit later. So here I've picked an example of some training courses that we've started actually end of last year with DOAJ. We're looking at making sure that they're available in different languages and looking at different regions and focusing on those country connector countries. In a way, as a pilot, but this is something that we're extending into the coming year as well. So we have run a course since the last quarter of 2023 and made sure that we cover as many countries that we're working in much more closely within the country connectors or at the national and regional levels. So this course is still available. We're currently running a Ukrainian course and our last course for the European English course. And these are some of the countries that we're working in. And our goal here is to make sure that we understand not only the challenges and opportunities for the local publishers, but we make sure that they have a voice, that they have the capacity, that they understand how they can improve the quality of their own local publication. And parallel to this, we're also talking to the institutional management and policymakers for them to recognize and understand the value of the local publications in their countries and regions as well. So for us to establish a country connector in a country, we have formal agreements with Research for Life in an institution, a host country connector institution. And we're also working with the research and education networks, which are called RNs and NRENs. And at country level, also working with the government, so the ministries and the research institutions. And we really get a lot of support from our UN partner country and regional offices as well. Then I would like to really thank STM for providing us some of this data. So I've taken the example of open access uptake in some of the Research for Life eligible countries. So we'll see that globally, open access had a compound annual growth rate in between 2013 and 2023 of 18%. Whilst subscription only grew at about minus or less than 1%. And within the Research for Life eligible countries, they are proving that they're closing the gap between subscription only and gold open access. So I'm focusing mostly on gold open access. And the CAGR for gold open access in Research for Life countries over the same period is 26%, while subscription only had a CAGR of 9%. When you look at another example, in 2013, 45% of the global articles, reviews, papers, and so forth could have been published, or which could have published as gold open access articles, rose to 79% by 2023, which is a difference of 34%. And yet when the opportunity to choose gold has increased for authors in the Research for Life countries from 43% of output in 2023 to 82% in the same year, which is a difference of 39%. Then when you look at or consider authors, the actual authors and their choices within gold open access, we see that globally, at a global scale, this is increasing when it is offered. And in 2013, 23% of publications for which the author was offered the gold route were published gold. And by 2023, this figure rose to 48%. For the Research for Life countries, the uptake of gold open access increased slightly less, from 39% to 53% over the same period, but it still remains higher than the global uptake in the same year. So here are some of the countries that we are really implementing and really making sure that we provide that equity, if I can put it like that, equity of access by really understanding, working more intensely in these countries. So we have a mixed bag from countries that are in sub-Saharan Africa, some are in the southern parts of America, and some you find them in parts of Asia as well. So for us, this is something that we're continuously growing. Each year we add more countries. So when we consider the broader implications of open access, for us, we really want to make sure that there is active participation of lower income countries, researchers in the research communication, and that there's full representation in the editorial roles across peer-reviewed journals, and that we achieve a level playing field in global scholarly communication. And really looking into the future, that full representation is quite key, especially for the voices from the Global South, and enabling all global researchers to tackle societal challenges collectively and understand the true value of open access publishing for countries. So I will end on this, because for us, we do look at the similar indicators that Manisha spoke about. We look at what is the economic impact, what are the societal impacts, how are we impacting the capacities of the professionals in the country, what is the impact on policy development and the professional networks as well. Thank you very much.
Great. Thank you so much to this panel. I think that was a really great great diversity of viewpoints here. And we'll definitely want to take some questions from the attendees. But before we get into that, Blessing, you were telling us a really great story at lunch today about an example of like the grassroots like impact in action. So I wondered if you could share it with the group.
Okay, great. I scraped that out after Manisha's story.
No, I love it. Tell it.
This was really good.
It's so good.
So we have a doctor. This is one example, but we've got many examples. We've got a doctor who's was working in a public hospital in Senegal, and he was the only specialist. He was a urologist, and he was the only specialist at that hospital. He still works there, and he had a peculiar case that no one could resolve, and he did consultations with his peers, even looked around in the country, but they could not resolve this. And he uses Research for Life a lot, and he went back, took some time, went through the resources, and managed to actually solve the problem, operate on the patient, and the patient did very well. And we reached back out to Research for Life to really tell us about this impact that he is seeing in his day-to-day work. So for us, when we talk about the impact of availability of these resources, it's not something in the air. We really see this day by day in the different countries that we work. So for me, it's one of the case studies, and we have many other. We've got a report that just traces the impact, and we're currently actually finalizing an impact report of Research for Life that will be available soon.
Thank you.
Thank you.
Questions from the group, the audience? Okay, got Stuart back there.
Yeah.
Thanks. Hi, I'm Stuart Maxwell. Question about with demonstrating ROI. There's kind of a bit of a split for open access in that you're not requiring users to identify, but you would get it's if you can sort of demonstrate the audience better by having more understanding of the audience you've got, by them sharing that information. It would give a sort of better story on a lot of this ROI, because there's anecdotal stories that are there, but more sort of profiles of who is accessing open usage and making use of it. But it's difficult because there's not an intention to log in or anything else. Is anybody looking at initiatives to encourage users to share more about that so you can tell more of those stories? And if so, what sort of routes are you using to encourage that?
Manisha, Rhodri, any thoughts? Tasha, as the person who can determine.
I suspect that Stuart is trying to get me to say you can slice and dice counter reports geographically by country and by country subdivision, so state, if the publisher has included that information. As I said, Counter is privacy protective by design. We do not want to ever be sharing information about individual users. So you won't see that kind of super, super granular information. But I know that that is something that some publishers are doing internally with their internal analytics views, where they're sort of gathering some more granularity about, say, the city that somebody is living in, or getting them to log in. I would argue if you're putting up a registration wall and requiring people to log in, that's not open access, but far be it for me to make the rules.
Yeah,
Publishers,
Yeah, I was just going to agree with that. So it's obviously interesting to know, and a lot of the usage we get is from people who are authenticated because they're authenticated for other reasons anyway, because they've logged in to see subscription content, or they just are authenticated because they're at an institution which has some kind of relationship with OUP. But I don't think we do anything to actively encourage people to log in for the reason Tasha just explained. It's not really the spirit of open access.
Yeah, so maybe I'm not quite sort of. Would it be beneficial? Let's put this another way. So, say for example, you're looking in medical publishing. If you're able to encourage with other features of an open access platform to people identify as a patient advocate or as a practitioner or as a researcher or whatever else, you can have some more granularity of the profiles of who you are reaching for that as well. Is that crossing over into what you might be doing with open access? So not necessarily the institutional, but kind of sort of almost like a demographics type pieces that tells more of the story as well.
I think that's a pretty difficult thing to do. If you think about, for example, in the UK with the NHS and universities, and it happens in the US as well, right? They're so closely linked, and some of them are surgeons. So I was just talking to somebody from BMJ 2 days ago. So they publish with BMJ. They're a surgeon during the daytime, so they're hacking people up, and then they're also like, but they also have an affiliation with the university so that they can publish their work, but they're actually employed by Cardiff Hospital Trust. So trying to differentiate that is very difficult to do. And, even if you did that on a publication level, it's like who's paying the bill that day and how they're going to affiliate themselves on the actual article itself as well. So if someone did know how to do that, I think it would be quite interesting, but I think it would be a very difficult thing to do, apart from just saying, oh, right, we've got this hospital users. But then within a hospital, you've got like primary care users, you've got clinicians, you've got, healthcare workers, you've got so many different types. I don't think an IP range authentication could help you understand that. And I think that's a little bit on the GDPR.
There would be certainly GDPR implications. I think the closest you might be able to come would be to ask people to self-identify, but a lot of people would be reluctant to do that. Yeah. I mean, I don't know about you, but whenever I see a cookie box, I just say, reject everything, go away. And I suspect I would do the same if somebody said to me, are you looking at this as a patient advocate or a professional or blah, 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 blah. Just go away.
If I could say one thing as a moderator and also someone who works for a platform provider, I think there's also something to be said for the power of trust and publisher brand and the experience that you're creating and what you're giving to a community. When I was previously working at a nonprofit association, we did some experiments with a paywall on our news content, and we found that because we had such a direct and dedicated audience, people were far more likely to opt in, even though it was for marketing. So I think if you're putting out good content and you're creating a really great user experience, ask. Worst they could say is no. And then you can learn more about your users and give them an even better experience. Any other questions? We also have some in our pocket here to go through. Heather.
Hi, Heather Staines from Delta Think. This was a really valuable session, for so many reasons. I've got like a ton of follow-up questions, but I just wanted to ask Blessing one question, and I just have to say, if there are salespeople in the room, the immensity of the territory that Blessing is in charge of, almost incomprehensible. She was telling me about just the 10 countries she was going to try to hit this year. I'm wondering, with more of an emphasis on equity, if there are ever conversations with Researcher Life and publishers about not having that access tied to an institution. Because years ago, I was at a course materials provider, and we tried to connect into some data about Research for Life, and it became clear to me that it was the institutions in the country, as you noted. But are there ever conversations about whether that access could be expanded, because there are a lot of researchers who don't have institutional access? And I recognize that would be a big ask to change a lot of contracts, but I thought I would ask it.
Yeah, thanks for that, Heather. It would become a bit chaotic if I said it like that, because remember, Research for Life does not only provide open access resources, it also provides the closed material. So for us, we also need to make it a bit fair on the publishers. And we have that. I spoke about the eligibility criteria twice deliberately, because a lot of people ask, like, who gets access and who doesn't, even at country level. And we recognize that some of the institutions work directly with the publishers and some of our partners as well. And also within the countries, we have some institutions previously who've tried to manipulate the system, especially like international organizations and international institutions who can actually afford to pay for some of these resources, but try and use the back road. So I think that's why we really have that strict eligibility. Maybe in the future, if we get another way, but we do try and have within the country, especially working with the country connectors, we try and have programs that if you're a researcher, you're outside of an institution, let's say you've finished your PhD, or you're now working somewhere else where it's not eligible, we try and make sure that we link you up with the eligible institutions and see how you can get affiliation through them and have access to the resources.
Other questions? Okay, well, folks are thinking of something. As we've talked about, usage metrics are problematic, but they're also convenient, and they're numbers that people can wrap their minds around. As you know, folks on this panel have tried to use non-usage metrics to change hearts and minds, to influence stakeholders to make different decisions. How has that gone? What has been the success rate? What sort of headwinds have you run against? Manisha, did you want to start?
Yeah, I think that it's like that whole argument about alternative metrics, and I don't want to just focus on the product alt metric, because I think big numbers don't mean big impact, right? I think at the end of the day, what we're all trying to do is provide you with the raw data for you to make the decision on whether this was impact or not. And that is really controversial depending where you are in the world. If you think about what's going on in the US about women's reproductive rights, and, like if you're getting big high scores about particular articles saying, yeah, you should do it this way or not do it this way, is that a good or a bad thing? We saw what happened with the Wakefield thing, right? And the Lancet published that study that MMR vaccines cause autism. If often now and again, and I'm sure Michelle Herbert here, she's an altmetric specialist, will tell you there'll be a nice spike about that article going up again, and it's so many years old. But I think with everything, we have to take these data and use not machines anymore, use humans to really analyze it, take what you want from it, and think about how you're then going to build an impact story for REF, or use it to apply for a new grant, or continue a research study that was already funded by another by another funder, etc. So And I think the future is that we might be able to use artificial intelligence to help us provide more indicative information, but I think it's too scary to do that right now. So it's really like the beauty, the beauty is in the eye of the beholder, right? So it's you that makes that decision, and we give you the power to do that. And that's for all the products, even if you're looking at citation numbers. A citation number, a high citation number in a predatory journal, is that good? No, it's not, is it? So you want to do something about that.
To sort of pick up on that Wakefield thing, the Lancet is very far from being a predatory journal, but that paper has done an immense amount of damage around the world. So
it's been cancelled on lots of Facebook groups. So,
it's like we have to acknowledge that impact can be negative and damaging as well as positive. So while we all want to think about the positive aspects of research impact, we also need to use human judgment to be aware that there is no one size fits all. There is no single metric. There is no single qualitative way of doing this. And everything needs to be taken, never mind a grain of salt, you need a bucket of salt for all the numbers, and you need to apply judgment.
And put it in a research ecosystem, right? So that's why you put building dashboards, but then also having the sort of, the grassroots stories and when you put all of that together, that's when you can say, yes, I'm a powerful university. I've done this, I've done that, and this is, we can talk in a scholarly communications perspective. But I think on its own, in isolation, is dangerous.
We're talking about activities that require a lot of people hours. So how do we also account for that in funding requests, in monetary support for programs, that grassroots movement? Blessing, any silver bullets there?
So for us, we use more of indicators. We do use the metrics, but we look at the indicators. So in everything that we do, we look at what are the indicators. And I think that's why with the Country Connectors program, we're really trying to understand each country and each region. So, and making sure that we align to their own priorities. What are the indicators that we can then align to those numbers? Because sometimes numbers work, but they also have a limitation. But if we can show the impact, like the one, the doctor from Senegal, the story that I gave you, we have many of those. I think that really makes a difference. And we have many stories, even from the governments, where they are seeing the impact of research, and obviously it's helping them also to support research, to support the institutions, to give them a little bit more budgets, where they never had budgets, for example, in the libraries. So for us, we use a combination of both metrics and indicators.
Any thoughts from the audience before I go into another question? I want to make sure y'all have an opportunity. Great. Rhodri, you showed some really great metrics on positive impact of things like transformative agreements. So I wonder how is OUP applying those trends? Is that renewing transformative agreements? Is it new agreements? Is it new journals? Like how are those indicators of impact being digested by the OUP organization?
Well, I think with transformative agreements, there's an interesting stage actually where these came into being, I guess around like 2018, 2019, maybe a little earlier actually. It's hard to remember since the pandemic, as time has kind of gone strange. But we're in the process where we are renewing agreements. That may be anathema to the idea of transformation, but I think the transformation can take a reasonable period of time. That's okay. But I think there's obvious benefits there that we can see in terms of increased OA, increased subject OA, increased use. All the things we've talked about in this presentation, and supplemented by some of the things that Manisha and Blessing talked about as well, about the actual real-world impact of open access. So for us, I mean, we're a not-for-profit publisher, and we would like everything to be OA, as long as we can get there in a way that we can still continue to publish and publish well, not just publish well, thinking about the research integrity questions we talked about earlier today. So I think it's kind of active reinforcement that these agreements are doing good things, and we'd like to do more.
Great. I don't think 2 minutes is enough time to go into another. Oh, here we go. We got a question.
I have a follow-up on that exact point. You'd like everything to be OA.
Yeah.
How is the revenue based on those transformative agreements for OUP?
Well, I mean, it's a complicated question, but I think, I think the transformative agreements. Someone mentioned earlier, I think it was yesterday's presentation, about consortia. Consortia are there to save money. I think transformative agreements do a couple of things. They do increase the proportion of content that's published OA. And then they do so in a way that would be cheaper than the mechanisms that existed beforehand, for sure. So paying individual APCs would be a lot more expensive. I think we can have a conversation about the details of how that works, but all our agreements are publicly available on ESAC, so you can also take a look if you like.
Just to follow, it's tough sometimes to hear an answer like that when I can go and look at Wiley's quarterly reports and they're not here to have that conversation, and I can extrapolate that data on a per article, per quarter basis on how open investment is changing. That's the return on investment that I know it takes up a lot of oxygen in this conversation, but it's missing from this particular one.
Okay. Yeah, I mean, you can have a look on any of our transitional agreements. They are all, as long as the institution has made them available, because we can't. Deposit agreements and ESAC institutions can do it, but most of them do. And you can go and look, and institutions have varying opinions about whether they redact certain numbers, but we don't ask them to redact any numbers. So in many cases, you can see the price paid, you can see the number of articles. So that information should all be publicly available and transparent.
Great. We survived 6. Malavika. Great. Thank you, everyone.
Amazing moderator.
Yeah.
Really good.
Hello, hello, hello. You guys look great. Look at this. I'm seeing you all from here for the first time. Hi. Hi. Go on, give me a wave. Oh, yes, yes. We're going to be able to stretch now. This is good news, right? Good news. Before I get into the details of the lovely evening we have in store for you, first, thank you, Hannah. Thank you, panel. And I should also, as I'm closing out the day, say big thanks to all our speakers online, here in the room, all our moderators, and the tech team. The tech team, respect. Thank you. Great. So the good news, folks, is that we can now joyfully bound out of this basement, upwards and outside into the glorious city of Lisbon, right? We're going to the Estufa Fria. It's a greenhouse and gardens kind of place. So some green and some tree bathing will do us all good, I think. I should note the reason this is possible is MDPI. They are sponsoring the reception, so thanks very much to them. Now, folks, you are getting yourselves there. There are some options, and I think we have some directions coming up for you in a second on the next slide. But you're getting yourself there. Your options are a 21-minute walk. It is Lisbon, right? Cidade de Sete Colinas. Okay, if I have said that right. If not, I'm willing to learn. I love languages and different sounds. It's the city of the 7 hills. Not only Rome, also Lisbon. So it is uphill, but if you want to have a leg stretch, it's a 21-minute walk. It is a very quick taxi ride. It's only a 7-minute taxi ride. So as long as the traffic allows, you'll be there very quickly. It is 2 stops on the Blue Line if you want to take public transport, but there's an 8-minute walk on either side, so it's practically the same as just walking all the way, but your choice. If you are taking a taxi, an Uber, a Bolt, whatever, it is highly cost-effective in Lisbon. Please, could you group up and share, offer somebody a seat? Amazing if you pair up with people or group up with people you don't know and you can start the networking early. Ooh. But however you get there, when you do get there, and this you need to know, when you do get there, you have a little bit of a walk through the gardens. And this does involve some stairs. Some of them are uneven. If you have any concerns about navigating this, there is a way to get all the way to the entrance, to the venue entrance itself by car. If you need that, can you find Bernie? Can you find Ruby? Can you find me? Or email conference@oaspa.org. We can sort it out for you. We want everyone to get there happily, and then we will have a great time. The start is 6:30, so you've got plenty of time to get yourselves there. It goes till 8 o'clock, and you will have drinks and canapes suiting different dietary requirements on offer. So drinks and canapes at the Estufa Fria from 6:30. Thank you, MDPI. I look forward to seeing you all there. Thanks.